Hey everyone, welcome to the Autoimmune Dietitian YouTube channel. My name is Annie. I'm a registered dietitian and I work with people struggling with autoimmune diseases. In my work with my clients, I help them use both food and lifestyle as a way to improve their energy and hopefully get them back to where they were feeling before they were diagnosed. So today we are talking about autoimmune diseases and pregnancy. So, hormonal shifts seem to affect autoimmune disease development and progression, and there are a few pivotal times in a woman's life specifically when these shifts happen. And one of them is uh, after after women give birth. So, while the evidence isn't super strong for this phenomenon, it does happen, and a risk is there that people do develop autoimmune diseases postpartum. So, today we're going to talk about this risk and what you can do to protect yourself after pregnancy. And if you already have an autoimmune disease, we are going to talk about things you can do during pregnancy to help avoid flares. So before I jump in, I just need to attach my usual disclaimer to this video that the information in today's talk is not the substitute for the diagnosis, treatment, or care of disease by a medical provider. This is for informational purposes only. Please consult your qualified health professional for any changes you make to your medical care. Okay, so what is the risk of developing autoimmune diseases postpartum? So, pregnancy does actually increase the risk of developing an autoimmune disease. And while the mechanism isn't clearly understood, researchers believe that it has to do with fetal cells remaining in the mother's body after birth. Pregnancy creates a very complex balance of hormones and immune system regulation in the mother. So, it may be that the fetal cells trigger some sort of immune reaction postpartum. In a study done in 2011, researchers compared different pregnancy outcomes, vaginal delivery, C-section, and abortion, and no pregnancy, to the risk of developing an autoimmune disease. And they found that the risk of autoimmune disease was greater within the first year of giving birth for both C-section and vaginal births, but lower for women who had abortions or who did not get pregnant. So, what else could be the reason why this phenomenon happens? So, again, there's very limited research on this topic, but it is really important to note that nutrient depletion could be one of the triggers for postpartum onset of autoimmune disease. So, the link between nutrient deficiencies and autoimmune diseases has been looked at. Things like vitamin D, magnesium, zinc, and vitamin A are all have all been researched and seen to be low in women who develop autoimmune diseases. There was a study out of the UK. It found that 9 out of 10 women were deficient in multiple vitamins at the time of conception, and many of them developed more vitamin deficiencies later on in pregnancy. So, granted, most women are advised to take a prenatal vitamin throughout pregnancy and while breastfeeding, but if they are already deficient before conception, I would imagine it would be hard to bring those levels back up to normal while supporting a growing fetus. Um, I'm also going to mention here that nutrient depletion has been linked to postpartum depression. So there are consequences of not having your nutrient status up to par, both before pregnancy and after pregnancy. Again, the connection between nutrient depletion and autoimmune disease isn't very strong, but just something to consider as well. So, what if you already have an autoimmune disease? Because most of you who are following me probably already have one, and you're probably curious as to what happens to your condition when you become pregnant. So, pregnancy affects autoimmune diseases differently. In my last video, I talked about the Th1 and Th2 balance of helper T cells. So pregnancy actually shifts from pro-inflammatory and cell-mediated Th1 immune response to an anti-inflammatory and antibody-mediated Th2 response for fetal survival. Therefore, diseases that are Th1 dominant, like RA, rheumatoid arthritis, multiple sclerosis, and psoriasis, tend to go into remission during pregnancy. And conditions that are Th2 dominant, like lupus, tend to get a little bit worse during pregnancy. Postpartum, this switches. So those with RA, MS, psoriasis tend to experience flares postpartum, while lupus patients tend to see their symptoms improve. Breastfeeding does delay kind of that shift a little bit, but usually once people either start breastfeeding or if they've been breastfeeding for a long time, because breastfeeding can actually be protective for some autoimmune diseases. Once the breastfeeding stops, that is when people typically experience reemergence of their kind of disease and conditions. So what can you do, right? We all want to be empowered to take control of our own health, and this may feel like a lot of this is out of your control, but it's important to really focus on, what you can control, and that's diet and lifestyle. So eating a very balanced diet and healthy diet before and during pregnancy is super important to avoid nutrient deficiencies. Again, managing stress, getting quality sleep will also help, and avoiding toxins and other chemicals help keep your what I call your bucket from overflowing. So that's what we have today. Again, we talked about pregnancy, the increased risk of developing autoimmune diseases after pregnancy, why this is, also what happens if you already have one, how can you kind of go into pregnancy with a frame of mind knowing that either your disease will either go into remission or be exacerbated. And there is a lot that you can do to kind of manage your symptoms during this period of time. If you would like more help managing your autoimmune disease, your digestive issues, or reducing inflammation, I would love to chat with you. I offer free 15-minute discovery calls to learn about your goals and to see if we are a good fit for each other. So in my YouTube profile, there should be a link to book a free discovery call. If you can't find it there, go to my website, annierubin.com. On the contact page, you can either send me a message through there or directly book a discovery call on the website. While you're on my website, I've got lots of free download materials. My newest one is available now, so check that one out. And lastly, you can sign up for my newsletter. It comes out every Thursday to your inbox. Again, always trying to give you information to manage your autoimmune disease with diet and lifestyle. And then if you enjoyed this video, please hit the subscribe button. These come out every week. Again, just trying to give you lots of information to help you succeed. So thank you for joining me, and I will see you next time.